Before I start here for a second, I want to throw out a concept, because I think this whole dialogue of patient to physician or pharma and stuff is really breaks up where we think we are. I think we are a systems medicine company, and we're committed with the diseases that we operate on to really building an environment where you can make decisions based on total information of the impact of your decisions on your pathology, the quality of life, and the other components that you're working with. Now, there are a lot of value that comes out of that, so I'm just going to show you really quickly the patients themselves and give you a sense of the kind of data we have. So this is just patients that just updated this morning. You'll notice there are 8,000 patients with public profiles out of 60,000 patients total. If I hover over this paper right here, Gravity Boy, you'll see that right now that they're functioning moderately well and under low distress, and that this person is dealing with depression. And you can see that it's a combination of depression and emotional control issues, for which we have data going back roughly monthly for as long as they've been a member of the site, as well as daily information. If you go through and you look at a new community here, this is an epilepsy patient who has a partial epilepsy syndrome. If I can drill through.
But he's starting like
Go and we look at this epilepsy patient for a second. Just pull her up. What you're seeing here, and again, I'm picking a patient that just updated, so there's a risk here, that your physical, mental, and social well-being. I know that she's having seizures, and on March 20th has been clean and a mild seizure, and it's a complex partial, so it's not dramatically related. That makes a difference. See the drugs that she's on, and if you just click through very quickly, you'll see what happens when you aggregate this data. So this is UCB's drug that, and I think that relates to specifically their commitment to a community because they believe they are best in class in their learning. And you see here, there's data on roughly 200 patients using the drug out of 1,000 in a community that's only 4 months old. So just think about that for a second. 4 months old, we're rivaling clinical trials levels of data in this condition now. And you see, it's a very highly rated drug for its efficacy. You also can see that there are serious side effects, and they vary between none and moderate for most patients to mild and severe for some. And you can see the breakdown of those side effects as they're reported. You see the dosing. Information is not normally available in this format, and this is all patient self-reported. If you bump over and you look at a second for symptoms, what we have here is sort of a breakdown of the total impact of the patients on their symptoms. The internet's working right now. And you see here anxiety, depression. And I'm looking currently only at the epilepsy community. But if I step out and look at all communities, you're going to see here data on roughly 25,000 patients on their current anxiety level, fatigue, anxiety, and you can see the variation across community and break this down. Now, this obviously, if you're a pharma company, raises concerns, because let's think about what the business, actually, not even pharma, what is the business of healthcare? So the business of healthcare is the question of, does this work? What are the risks of doing it? And how do I communicate to the people that need it that it's available? And that is the business of pharma beyond the making of the drug itself. And so, the first thing I would do is if I were part of the system here, I'd worry about something, I'd want to log in, and if I saw an adverse event, and I go, Indy, you're going to want to go program. Where's my clock? 1 minute, all right. So there's, so I'm logged in now, and I can hit this little PV window, and it's going to let me enter for any patient an event, either from free text, and all of the ones that are coded are automatically streamed. So we have operational, behind the scenes, a fully deployed pharmacovigilance system that probably will, within a year or two, for all drugs, for all companies, regardless of whether their clients or not do this. UCB helped us build this because of their commitment to the safety of their patients. And we're expanding it out and learning from it as we go. But at the end of the day, all this really is this information exists in a matrix. And this matrix, and again, I'm just going to show you what you really want to look at from a patient standpoint. So here's my brother. There's his symptoms. There's his treatments. Those are his side effects. And I want to know all of his symptoms on the left-hand side, all of his side effects across the top, and the impact of every drug based on everyone else in the world on it. So you can see what helps and what hurts. And you can see the contrast between excess life and constipation. So how do we give products to pharma here? So the product of pharma is the ability to watch what's going on. So there are 490,000 posts in the MS community, of which there are, 6,000 on Rebif and 7,000 on Tisabri. And I can look at this, just like a stock chart, and look at the frequency, and see whether these correlate with announcements or not. And if I pick on a drug like Avonex, and I log myself out here. I can see specific difference between the brand and the treatment. And you can see this in real time, and then you can ask for and ask us to do sentiment analysis following that. But the last thing is, does the drug actually work? And I'm going to give 10 more seconds here. This is a report that is available internally, which says I'm looking at age versus bladder problems in the MS community. And it tells you the frequency. I'm looking at the expectedness. And you can see they're increased in elderly patients and decreased in the younger patients. And there's a correlation across here. But if I was interested in something different rather than age, say body mass, I could just update that graph, re-pull the data out, ask for the information presented in an expectedness curve, and see that body mass index also correlates with increasing over time. But if I had a drug that, say, had a side effect report that was correlated to this, and I wanted to know if my drug was something that patients took because they were heavier and that might influence the side effect reporting, I could look at the treatments and all the AT compounds, update that, and pull this in real time from a community of 15,000 people, and to begin to make effective decisions to begin to look at what goes on in the community. So this is about safety, efficacy, and understanding how people understand the treatment.
Thank you so much, Jamie.